Hello everyone, now let us discuss about CPT coding guidelines for radiology part 7. And in the current session, we will be focusing on bone and joint studies. So before going into CPTs, let us first briefly discuss about adult skeletal system. We all know that the skeletal system is principally categorized into two parts, axial skeleton and the appendicular skeleton. So the root word for appendix is to hang on to. So the skeletal system is of two principal groups, axial skeleton and appendicular skeleton. Now let us discuss the various bones of axial skeleton and appendicular skeleton. The axial skeleton is mainly composed of 80 bones made up of skull, which is composed of cranium. Cranium has 8 bones and face has 14 bones. One hyoid bone, auditory ossicles 6, vertebral column 26, thorax is composed of sternum and ribs, 1 sternum and 24 ribs. Altogether, the number of bones in axial skeletal system are 80. Now coming to appendicular skeleton, as the root word appendicular means to hang on to. So the appendicular skeleton is mainly composed of pectoral girdles, which include clavicle, 2 clavicle and 2 scapula. Then coming to upper limbs, which include 2 humerus, 2 ulna, 2 radius, 16 carpals, 10 metacarpals and 28 phalanges. Now coming to pelvic girdle, it is composed of hip, pelvis or coxal bone, 2 bones. Coming to lower limbs, they are composed of 2 femur, 2 patella, 2 fibula, 2 tibia, 14 tarsals, 10 metatarsals and 28 phalanges. So altogether the appendicular skeleton is composed of 126 bones. So the total bones of an adult skeletal system are 206. 80 from axial skeleton and 126 from appendicular skeleton. Now coming to the various CPTs of bone and joint studies. The first CPT is 77071. It is mainly applicable for manual application of stress performed by physician or other qualified healthcare professional for joint radiography, including contralateral joint if indicated. Next CPT is 77072. It is composed of bone age studies. Whereas 77073, it is mainly composed of bone length studies. It is also called as orthoentenogram or scanogram. Now coming to next CPT 77074. It mainly deals with radiologic examination of osseous survey. Limited. Example, to study any metastasis. 77075, it deals with complete radiological examination, which includes axial and appendicular skeleton. Next 77076 is composed of radiological examination osseous survey infant. Now coming to next CPT 77077. It deals with joint survey single view 2 or more joints, whichever we specify. Next is 77078. It deals with computed tomography bone mineral density study 1 or more sites. Axial skeleton. Though the name axial skeleton is specified here, for studying of bone mineral density of hips and pelvis are also included in this CPT. And similarly for 77080, dual energy X-ray absorptiometry DXA, bone density study 1 or more sites, axial skeleton. Here also hips and pelvis and spine are included in this CPT. So whenever we study the DXA studies of hips, pelvis or spine, we need to report 77080. And similarly, when study bone mineral density study of hips, pelvis and spine, we need to report 77078. Now coming to next CPT 77081. It deals with dual energy X-ray absorptiometry DXA, bone density study, one or more sites, appendicular skeleton, which deals with radius, wrist and heel. Examples. These are some of the examples. The next code is 77085. Here you can find a number sign. So this indicates that this code is out of numerical sequence. That is, after 81 you need to get 82. But suddenly you got 85. That is indicated by this number sign symbol. So the description of 77085 is DXA bone density study axial skeleton, which includes hip, pelvis, spine, some of the examples, including vertebral fracture assessment. The DXA bone density study of one or more sites axial skeleton, including vertebral fracture assessment, is given by 77085. The next code is 77086. It deals with vertebral fracture assessment via DXA. So, if only vertebral fracture assessment is done via DXA, you need to report 77086. Whereas if bone density study of one or more sites of axial skeleton are included along with vertebral fracture assessment, you need to report 77085. And do not report 77086 in conjunction with 77080 and 77085. Now coming to next code 77084. It deals with magnetic resonance. Example, proton imaging, bone marrow, blood supply, etc. So coming to next codes 77089. Here they are indicated by bullets. So the bullets indicate that these are new codes that have been included in 2022. So coming to the description of 77089, it deals with trabecular bone score TBS, structural condition of the bone microarchitecture using dual X-ray absorptiometry DXA or other imaging data on grayscale, variogram, calculation with interpretation, report on fracture risk. And one more important point while dealing with CPTs is you have to check whether the CPT is starting with a capital letter or a small letter. If the description of a particular CPT is starting with a small letter and some space is there before it, it says that that code is incomplete. That is, the description is incomplete. So in order to describe 77090, you need to see here the technical term, the T is starting with small letter. That is, it indicates that there is some description missing. So the correct description of 77090 is trabecular bone score TBS, structural condition of the bone microarchitecture using DXA or other imaging on grayscale. Technical preparation and transmission of data for analysis to be performed elsewhere. And similarly for 77091, it deals with TBS, structural condition of the bone microarchitecture using DXA, technical calculation only. So we have to take these points also into consideration. The bullets indicate that these are new codes. So the next code is 77092. This is also indicated by bullet, that it indicates that it is a new code, and you can see some space is there before the code and the first letter is starting with small. So first you need to go back to the description where the description starts with the capital letter. So this is also an extension of TBS, structural condition of bone microarchitecture. Here, interpretation and report on fracture risk only are done by other qualified healthcare professionals. By this we complete bone and joint studies, CPTs. Let us discuss an example. A patient on estrogen replacement therapy receives DXA study of hips. What is the CPT reported for bone density study? The appropriate CPT for this scenario is 77086, which includes dual energy X-ray absorptiometry, DXA bone density studies, one or more sites, axial skeleton. Here, under examples, hips, pelvis and spine are included. So this is the appropriate code for this particular scenario. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.